Hey y'all, it's Kosta. On this channel, we explore the unavoidable truths and innovative solutions to the long-term care industry. In this video, we're talking about how Swift skin and wound care is completely changing the trajectory for point of care and long-term wound care. So a third of home health patients are going to need wound care. Secondary to that, wound care is more prevalent than the three most common cancer diagnoses. When it comes to wound care, the biggest problem that we're faced with is that so many people need that type of care. However, there's not enough nurses and people that are qualified and trained to be able to administer it. That's why Swift is so necessary. This technology allows us to bridge the gap between the supply of nurses and the demand for wound care by optimizing and making these processes simpler. So if you need to know the measurement of a wound, the stage of a wound, the location of a wound, whether a wound is healing or not, Swift can use artificial intelligence to be able to automatically give that information to the nurse that's assigned to your case. And that optimizes the care process in its entirety, where you typically have to have somebody come to your home and evaluate you on site. You can do this remotely, which means more nurses can serve more people, thus bridging the gap between our supply and demand. So in the traditional sense, what happens is if you suffer from some type of wound, whether it's infected or not, it's already going to put you in a position where you need to have medical treatment because it can turn into something dangerous. Now, if you go to your primary care physician and you say, hey, I fell and I have an open wound on my leg or on my arm, your doctor is going to write you an order so that you can have home health come in and be able to offer wound care services. Now, like we talked about with regards to the lack of supply of nurses, it may take a while for that nurse to come out and be able to evaluate your wound. Secondary to that, they don't just come out once. They have to consistently come out and check on the size of your wound, whether your wound is healing. And here's the crazy part, 50% of wounds never heal. That means that when you suffer that injury and you have an open wound and it starts tunneling in different directions, you might be stuck with that forever. And think about how that impacts your health, your quality of life. What Swift does is it's an app, and it allows you to communicate with your primary care physician, the nurse that's assigned to your case, and maybe even a family member that might be a medical power of attorney. The reason it's so important and the reason why it's transformational is because it uses artificial intelligence to map and graph the stage your wound is in. So you don't have to have a nurse that keeps coming out and checking on the progress of whether or not you're healing. It allows you to automatically interact with the people in the healthcare systems that are in charge and know exactly how to respond. So the sooner that you can get the right type of healthcare, the sooner that you can get access to your nurse, the quicker your wound is going to heal and the less likely you are that you're going to develop even more chronic illnesses from a wound. Swift is so necessary because you can have all of this in real time, and more importantly, you can do it through AI. So there's a lot of things that you don't know about the diagnosis of a wound on your arm or leg or chest, and that AI technology will tell the healthcare professionals everything that they need to know and also what they should expect. So you guys are probably asking yourself, will I ever need wound care? And the answer is yes. You probably have a 4 in 5 chance of needing wound care before the end of your life. Think about this. Let's say you're swimming in the pool with your family and friends and you get out and you go up the stairs to the kitchen and you're bringing down some food, and let's just say that the stairs are wet and you fall and you get a laceration on your leg. Think about this, guys. That wound could take months to heal. If you don't have access to proper treatment, it could take years. That means that you could have muscle deterioration, you could have loss of mobility, and it could also lead to even more significant health outcomes, like someone saying, I don't know if you can navigate around your home anymore, so I don't know if you can live here anymore. You may need to be in an assisted living facility or in a nursing home. And that's the whole point of this conversation, is we have to have technological solutions to a lot of these long-term care problems, because if we don't, and we're not bringing in people to be able to fill the need that we have for long-term care, then we will have people suffering. We will have people that can't find access for healthcare to their long-term chronic illnesses. And that means that more people will have to leave their home, the place where they want to age, and go into facilities and essentially warehouse our elderly population, which is the very last thing that we want to do. So these technological applications, like I said, to bridge the gap between the demand for healthcare and the supply of people that we have, is the only possible solution for us to solve the long-term care crisis.